Hi, my name is Dr. Dave Anderson. I'm a clinical psychologist with the Child Mind Institute. Today we're going to hear from a parent who's looking for help understanding ADHD. This parent asks, as a parent of 3 kids, I've heard so many different things about ADHD at this point that I'm not sure what to trust. What's the difference between ADD and ADHD? Could my youngest son, who is really quiet and calm but easily distracted, have ADHD? I'd love to have a better understanding of what ADHD really is. So we've got 2 questions here. One is, what's the difference between ADD and ADHD? And then the second is, this kind of question that lots of parents have where we say, if my child appears like this, does that mean they necessarily have ADHD? So the first one, in terms of what ADD and ADHD are, ADD doesn't actually exist. So it hasn't existed since, in fact, the end of the 20th century. Psychologists and psychiatrists and other mental health professionals at that time issued a new version of the DSM, the Diagnostic and Statistical Manual of Mental Health Disorders, and characterized the condition only as ADHD with different presentations or subtypes. It was earlier subtypes, now it's presentations. ADD, the reason why it persists in our nation's consciousness is because it has less stigma associated with it. People think, well, if it doesn't have the H in it, that means it might be a less severe form of the condition. And that's not actually true. What we wanted to be able to convey to the public, to parents and caregivers who wonder about whether or not their child is struggling with ADHD, is what the condition actually is. So it's ADHD, Attention Deficit Hyperactivity Disorder, and it has 3 presentations. What that means is there's an inattentive presentation, there's a hyperactive-impulsive presentation, and then there's a combined presentation. So when we look at the symptoms of ADHD, there's 18 symptoms, 9 on an inattentive axis and 9 on a hyperactive-impulsive axis. In order to be diagnosed with ADHD, you have to have at least 6 on either the inattentive axis or the hyperactive-impulsive axis, or you can have at least 6 on both axes, and that's how you get diagnosed with one of the 3 presentations. The reason why we call them presentations is that while the diagnosis of ADHD is very reliable, in the sense that if a child is diagnosed with ADHD at a young age, that diagnosis tends to stay with them through to adulthood. However, they can present slightly differently in terms of their symptoms at younger and older ages. So we don't want parents to think that your child doesn't have ADHD if the presentation changes. We want to make room for that. In the same way that with a common cold, certain symptoms might present, and when one person has a cold, they might have more of a runny nose and a fever, and when another person has a cold, they might have a cough and a runny nose. So we want people to understand the presentation can look a little bit different, even if the condition, ADHD, is the same. So when we look at people diagnosed with ADHD in each of those presentations, the inattentive symptoms might be a kid who is having difficulties with focus, is distracted while they're in class, has difficulty organizing themselves or demonstrating age-appropriate organizational skills, those kinds of symptoms. On the hyperactive-impulsive axis, it's a kid who fidgets a lot, can't stay in their seat, is really moving around a lot, seems like they're driven by a motor, those kinds of symptoms. And you can have either inattentive symptoms or hyperactive-impulsive symptoms, or you can have both. Now, getting back to this parent's question about her youngest son, who's quiet and calm but easily distracted, the key distinction in a question like this is that we don't diagnose ADHD based on a single symptom. ADHD has a cluster of symptoms, but then when we're engaging in a kind of diagnostic interview, what we're looking for with ADHD is whether those symptoms are present across multiple settings. ADHD is a brain-based mental health condition. So given that it's brain-based and not something that comes from, say, someone's environment or the stressors they're facing in their family or at their school or with friends, we think of it as something that must present across settings. So we'll ask questions about whether symptoms present at home, and then we'll ask questions about whether or not symptoms present at school or with friends. And if we see that these symptoms present with family and at school, that's what gives us information where we might say, okay, this child might satisfy criteria for a diagnosis of ADHD. The other key aspect of any diagnosis is understanding whether these symptoms are impairing or whether they're developmentally appropriate. So with a young kid, now in this particular parent question, the parent doesn't say how young their child is, but with young children, being distractible or having difficulty maybe sitting for morning meeting or maybe feeling like you're not paying as much attention in class can still be age appropriate, particularly when kids are at the younger end of the class. So we're considering all of those things as we're thinking through the diagnosis and trying to assess, are other symptoms present, are they present across settings, and are they really impairing the child at a level where they may not be able to engage in school or where it's creating a lot of conflict at home such that we would really need treatment. To learn more about ADHD, visit childmind.org.